Well, first of all, thank you for this great opportunity to present what we are doing with Germany. I know I'm in a tough position. I'm the last stop to a glass of beer or wine, so I'll try to be short. But to answer your question, maybe one thing that you could see on the internet about me is that I have been starting my career as a scientist in a medtech company. I was fortunate enough to have to lead the group of scientists from discovery to market. But what you won't see on the internet is that, well, I had developed a diagnostic test, but it failed on the market. In fact, it was a very shocking experience, as you can imagine, but it was also a very significant learning experience for me, because I was naive at that time. I thought that as a scientist, all you have to do is to do great research and then that's it. There's a success, and it certainly doesn't work like this, and it changed my whole career after that. So that being said, what I would like to do today with you is to share our collaboration with Germany, between Canada and Germany. Before I do this, I would like to stress, I know that we have been discussing this a lot today, but I would like to stress how important it is if we really want to find real solutions to very complex problems. We need to work together, of course. And what I mean by this is we need to work not just between researchers, but also across disciplines, across institutions, and also across countries. And so what I would like to do with you is to tell you why is it so important for us to work with Germany, how do we do this, and at the end I'd like to make a special announcement on our collaboration with Germany. So before I do this, I'd like to introduce very quickly what is CQDM. So CQDM is a pharma-based consortium. So our mission is to fund the development of tools that can really accelerate the drug discovery process. So really we are addressing the lack of productivity that we see in the pharma industry, basically. Part of our mission is also to make sure that we are going to create a collaboration ground so that we make sure academic institutions are working with biotech companies and pharma industry as well. And I will show you how we do this at CQDM. So we were created by 3 big pharma companies, Merck, Pfizer, and AstraZeneca. We are funded by the Canadian government and the Quebec government as well. And later on we had additional big pharma companies joining CQDM, so now we have 9 big pharma companies working together. And the whole concept is that we want the pharma companies to work in a collaborative approach. So we share the cost of the research. So we do all this because it generates a leverage. So all the money that we have at CQDM is put in a piggy bank, and this used to fund all the research projects. So we do this because it creates a leverage, and in some cases it can generate a pretty impressive leverage, up to 25-fold. So because we have that leverage, we can afford to take risk and fund high risk, high reward type of research. Probably research that a single pharma organization would not be able to fund alone. That being said, one important piece of our business model is also about working with strategic partners. So we have been working with groups across Canada and outside Canada as well as co-funding partners. So whenever we have a project that is of common interest, we are co-funding the projects together, and we generate even more leverage. So we can generate more impact with the same amount of resources. I would like to highlight tonight our collaboration with the Ministry of Economic Affairs and Energy in Germany. So we have partnered with them to co-fund projects, and I will tell you how we do this in a minute. So basically, CQDM is a funding body across Canada. We can fund SMEs, academic institutions, and we have, so far we were created in 2008, so far we have funded 50 technologies for about 40 million Canadian dollars. But we add to this 30 million from strategic partners. So as you can see, it's quite of an impressive leverage. With that, we have funded over 600 researchers among 70 different institutions, public and private. And the success rate of our technologies is pretty high. We have around 90% of a success rate. One metric that is extremely important for us is the level of integration within the pharma industry. It's about 83%. I forgot to tell you that in our model, the pharma companies are sharing the cost of research, but at the end they also share the results. They have a right to use the technology for research purposes only, so they don't have any commercial rights. But we are funding tools that can be used for research, so that's, you know, the perfect setting. So the level of integration within the pharma industry is telling us, you know, that we can at least generate something that is of interest and potentially of impact for the pharma industry. Now, I would like to, and the success rate that we have and this level of integration that we have at CQDM is probably due to our mentorship program that is pretty unique, I think, in our setting. So basically, it's designed for all funded projects at CQDM. We can nominate a mentor that is a senior scientist that is identified within the global pharma organization. So the mentors are really there to make sure that what we are developing will be aligned with the needs of the pharma industry at the end. We see many different examples where mentors are getting involved in the research project. And we, as you can imagine, this mentorship program is very much appreciated by the researchers, but also by the mentors, because they are well positioned to appreciate the value of the technology. And at the end of this, we see a lot of extremely significant partnerships being done at the end of the projects between the pharma industry and the researchers funded by CQDM. That being said, I'd like to take a few minutes to try to promote or tell you why it would be interesting for Germany to work and to collaborate with Canada. So first of all, we have several existing partnerships between Canada and Germany, and I think this is extremely important. When two countries want to work together, we need to have the buy-in of both governments. At different levels, and we have a lot of different agreements already signed, already in place at the federal level, but also at the provincial level, which is really helping us a lot. What we also need is to have some funding mechanisms to stimulate collaboration, and this is exactly what CQDM is trying to do. I'd like also, maybe I'm a little bit biased here, but I'd like to say that we have a very strong research infrastructure in Canada. It's not all perfect, of course, but I think we have a very nice critical mass of biotech companies, of pharma organization. Also, something very interesting is the Network Center of Excellence. I know Nathalie had mentioned this earlier today. But we have about 50 different networks in different fields across Canada that are dedicated to translational research and trying to bridge the gap between discovery and the market. I think we have a very interesting critical mass of early stage research. We may not have this, or maybe not that great in bringing these technologies to a later stage, but I think this is really representing a nice partnership opportunity. We have several sectors of excellence. I don't want to describe all of the sectors we are in, but certainly to say that at least oncology, neuroscience, regenerative medicine, personalized medicine, and genomics, and many others as well. Also, I'd like to highlight some of the network centers of excellence that are very active in life science, and some very innovative funding bodies and research consortium. I'm also with my Canadian colleagues, Rafi, Nathalie, and Aled, who are leading some very innovative new models that are really focused on translation, bridging the gap between discovery and the market, of course. And I'm very proud to say that CQDM is one of these network centers of excellence. Now, how do we partner with Germany? So we have initiated a call for proposal and a funding program with the German federal government through the ZIM program. So basically, it's to select projects, collaborative projects between Canada and Germany that are of common interest for CQDM as well as the ZIM program. And the bottom line is that we want to see some true collaboration, of course, collaboration that will show a clear synergy and generate economic benefits on both sides, Canada and Germany, and projects that will really increase our competitivity at the global level. So the principle is very simple. CQDM is paying for the portion being done in Canada, and the ZIM program is paying for the portion being done in Germany. What we really want to see again is the true collaboration, and this is really what we evaluate. We have initiated this call for proposals. We have received a lot of proposals, but I must tell you, to be really honest with you, the quality of the proposals that we have seen within this program is absolutely outstanding. So really, for me, it's really telling me that there are a lot to do between our two countries, and this is extremely exciting. Now, that being said, I'm extremely pleased to announce today our very first project that we have selected with the IEF and ZIM program. So it's a collaboration between McGill University and the Lead Discovery Center. And to tell you more about this project, I will let the investigators to talk about it. So if I can have the video, please.
Exciting project around an area which is not that well known in drug discovery.
To identify novel tools and drug candidates to nurture global research and drug development in the field of trafficking and protein folding diseases in its various shapes. The IPA project is going to be conducted as a team effort of two translation-oriented research groups.
We have very complementary interests and expertise, but McGill is interested in the endoplasmic reticulum and the diseases associated with it, and the Lead Discovery Center brings in a tremendous expertise in chemistry and drug discovery. The platform that we are together going to construct will be extremely useful for discovering new targets within the endoplasmic reticulum, off-target effects of known drugs, and also ways of ameliorating protein trafficking diseases.
We very much appreciate the positive vote of CQDM and the German Department of Commerce to fund the integrated platform for the pharmacology of the endoplasmatic reticulum.
So this is just a start. It's a very first project. We are very proud about this, and really what we want to do now is really to build on that, to build on all the great synergies that we have seen so far between Canada and Germany, and we will want to continue this partnership and fund additional outstanding projects. So that being said, I thank you for your attention.